Coming up, we will be on location at Dr. Halper and Associates in Fairfax, Virginia, discussing the importance of psychological testing and evaluations and how they can help correctly identify psychological issues and improve your mental health with one of this region's top psychologists, Dr. Elizabeth Halper. Dr. Halper graduated with a bachelor's in behavioral psychology from Bryn Mawr College and a master's and PhD in clinical psychology from Gallaudet University. She is a member of the American Psychological Association and the Northern Virginia Academy of Clinical Psychologists. Dr. Halper is widely recognized as a top doctor in the Northern Virginia region multiple times by Your Health magazine, among others. Welcome, Dr. Halper. It's a pleasure having you on our program.
Thank you for having me. I'm very excited to be here.
We are as well having you on. We've got a lot to talk about regarding a very important topic, psychological testing, evaluations. And I just wanted to ask you, as we begin here, that you are a clinical psychologist, but you do not provide therapy. And I wanted to ask you specifically, what area do you focus on that can help the folks out there?
Sure. A lot of people, associate psychologists with therapy, but there are other things that psychologists do, one of which is psych testing. So that's what my practice is focused on. And basically, psychological testing helps to accurately diagnose problems. And then therapy is how you address or fix those problems. So a lot of times, people might be diagnosed incorrectly or sort of guessing at what is wrong, and my job is to really pinpoint exactly what's going on.
Very interesting. Now, who would be a candidate to be tested? What can they get from the testing, and is there a benefit for them to be tested?
Sure. A lot of different people could benefit from psych testing, particularly those that have been on medication for a while or in therapy, but they're not feeling much better, things are not sort of progressing. Again, a lot of times people are medicated or in therapy, but they're focused on the wrong reason, or they're medicated, perhaps for the wrong thing. A lot of different disorders can look similar, the symptoms can look similar, so it can be hard to tell right away what's wrong. Other people that might benefit is, people in school that are struggling, or people in their jobs who are struggling and who may have struggled through school. All of those types of people can benefit because there are accommodations that can be provided either through the school system or, at the job site to help people function better, perform better, do their best.
Yes, very good points that you just made, because we hear and read literally every day how more and more folks, unfortunately, are suffering or afflicted with various mental health disorders, and it's been on the rise. We're talking millions and millions of folks. So I can see why it's so important for somebody to be tested.
Yes, exactly.
Now, what areas specifically, doctor, can one be tested for? What are we looking at?
You can be tested for a lot of different things. Some of the more common referrals that I get are for ADHD, depression, anxiety, mood disorders. You can also be tested for things like auditory processing difficulties, visual motor integration, sort of more neurological issues. And you can also be tested for personality disorders or characteristics, as well as areas that you might excel in for your occupation, so occupational skills and interest.
And I understand folks with learning disabilities and dyslexia, for example, can also be tested?
Yes, all sorts of learning disabilities, dyslexia, dysgraphia, math disabilities, reading disabilities.
Now, can you tell all of us what's the process of getting a psychological evaluation? What happens? How long does it take? Just so we have a better idea of what we're looking at.
Sure. When I make appointments, I try to basically get all the testing done in one session. Although with kids, I sometimes split it into two to make it easier on them. But people come at 9:30 in the morning, and I try to get them out of here around 4:30 in the afternoon. I give people a break for lunch and breaks throughout the day, but you start out with an interview, really go over the background of that person, exactly what's bothering them, what their concerns are, the history of those concerns. Then they do, they start testing basically for whatever the concerns are. So I don't give the same test to everybody. I tailor what I give to each person that comes in.
Oh, that's certainly good to know. It's basically customized based on each individual.
Yes.
Now, what happens when the testing, the psychological evaluation is all completed? What takes place next for the client or the patient?
It takes a couple of weeks for me to put all the data together and write the report. But when the report is done, I have the client come back in for feedback. And I try to focus a lot on providing recommendations and referrals that really give a roadmap for that person. So the report explains, okay, here's what's going on, here's the cause of your problem, and now this is what you can do about it. You can see this person that specializes in X, Y, or Z. You can, start this program that has been shown to help with your problem. So people leave with a plan of action.
So you're sort of like the MapQuest, if I may use that example or analogy. You really lay out the roadmap for an individual through the psychological testing as well as the psychological evaluation to really steer them in the right direction based on what you find through all that.
Exactly. The philosophy of my practice is that you can't fix something unless you know exactly what's wrong. Right. So I try to provide people exactly what's wrong and also how to fix it.
Very, very important. That's an important focus that you have with your practice, helping a lot of folks indeed. Now, I understand in addition to the psych testing and evaluation, you also offer Cogmed over here at your practice. Can you please tell us more about that?
Sure. Cogmed is a great program. It's being marketed for people with ADHD, attention problems, and working memory problems. But it is also very useful for other populations like people who've had a traumatic brain injury, a stroke, age-related cognitive decline, anything where you sort of want to boost your productivity and ability to organize, plan, and remember things. So it's a computer program that people do from home, and they are coached weekly with a weekly coach call or email or over Skype sometimes. The program lasts 5 weeks typically, and has been shown to improve working memory up to 32%, so it's pretty impressive.
Now we're running out of time, but I wanted to ask you, Dr. Halper, you and your practice here in Fairfax, Virginia have certainly established a reputation for excellence in the psychological field, testing, evaluations, as you've told us about today in some detail. I just wanted to ask you, can you please tell us what really helps separate you and your practice from some of the other practices in this region?
Sure. We have a niche because we only do psych testing. A lot of practices will offer both therapy and perhaps testing, but not very many really focus on testing. So I do consider myself and my practice to be experts in psychological assessment and evaluation. So, the other part is that I only schedule one person per day. I don't have multiple clients. People come in, I personally interview them, I supervise all testing. Either I do it myself or I have a couple of doctors that work with me, but I supervise directly the testing process. I do all the data analysis, I write the reports, I give the feedback. So it is very individualized, and as I said earlier, I tailor which tests I give to each person depending on what they tell me. They might say in the interview things that are different from what they initially said in our telephone consult, so I really try to adjust to address their issues.
It's a very one-on-one practice, like you touched on, very individualized. They're actually going to be seeing you, and you really have the time dedicated to each patient the way it really should be. Unfortunately, we don't see that enough in today's medical world, but it's great to know that you still provide that and do provide that to your patients.
Well, thank you.
And lastly, before we let you go, doctor, because we're literally out of time now, contact information, website, phone number for the folks on how they can reach you.
Sure. My website is drhalper.com, so DOCTORHALPER.com, or you can find me on LinkedIn. My telephone number is 703-988-4990. Any of those ways, people are more than welcome to email me. You can find my email address at my website.
Well, on that note, we'd like to thank you for joining us, being a guest on our program, and we'd love to have you back on in the future.
Oh, thank you. It was a pleasure.
It's our pleasure.